Again, we're returning to look at the Massachusetts healthcare law as it relates to the then Governor Mitt Romney. Governor Romney voted for reform. The state of Massachusetts was facing a crisis which might bankrupt the state. Romney was seeking a reform that would ease the burden on the taxpayers of Massachusetts, as well as the drain on the Medicaid process within the state. You and I might not agree with this bill, even if it passed in its original presentation, as Romney really wanted it to pass. Nevertheless, it was his attempt to answer a state crisis within the context of the state of Massachusetts and the Massachusetts political and social culture and environment, which is why I would never live in the state of Massachusetts. But nevertheless, the health care reform that was passed by both the House and the Senate in Massachusetts was a reform that the citizens of Massachusetts themselves wanted and supported, even in its revised form. Governor Romney sought the advice of those affected throughout the state. He did interview and talk to the doctors, the hospitals, insurance agencies, the citizens. He tried to find the best way to bring some sort of resolve to the issue. You must give him credit for that. However, a major difference was the majority of Massachusetts citizens wanted and asked for these reforms. A major majority of Massachusetts citizens wanted their representatives and senators to give them this law. However, the difference with the Massachusetts healthcare program and Obamacare is that Obamacare was forced upon the majority of American citizens who oppose it as an unread bill. According to the Boston Globe, who conducted a review of the Massachusetts Healthcare Reform Act, they stated that the reform has, after 5 years, worked as well as or better than really expected. My point to that would simply be this: whether it works or not, we're not really relying on pragmatic implementations to correct American healthcare. You just can't do that. Rather, we are trying to work on the principles that the Constitution have given us in order to resolve such issues. And if federal government would simply stay out of the healthcare business and allow our states to determine what is best and acceptable means to resolve these issues, that's exactly what we need to have done in America. Less government. Well, this brings me to my final point. Romney says that the major difference between the health care of Massachusetts and Obamacare is that these issues belong to the state. The state ought to determine how to handle these health care issues, not for the federal government to force their will upon the states and its citizens. This is, by the way, a correct view of states' rights over against the federal government. If your state does not put laws into place that please you, how do you deal with it? How were you supposed to deal with it when the Constitution was originally established? You vote with your feet. You move to another state. If you can't get what you believe is important in your state resolved, and if your state goes bad, you simply leave and go somewhere else that is more akin to your beliefs. But the problem is that after the war between the states, the Constitution is inverted by the 14th Amendment. Everything after the 14th Amendment is designed to protect the federal government and its authority and rights above every citizen in every state, and to keep the states from being able to interdict or interpose themselves between the federal government and its now declared citizens by naturalization or birth. And thus the federal government sees itself as being able to give mandates to its citizens and not fund them, and force the states that are now under their control, not a confederation of states who have come together to create a uniform government that they can work within certain areas together and allow yet the states to govern themselves. No. Now we've got this monster that's been created at the upper level, and it can mandate without funding the states resolve issues that they believe need to be resolved, and they're giving their mandate of how to resolve it, but they're not going to refund. They're not going to fund the mandates that they give. Well, the answer to that is that federal government must get its nose out of our lives. It needs to get its nose out of the government's business of the states. They need for the federal government to quit fixing what they see as the issues of the moment, and then to turn and try to decree laws from a national perspective to protect the 14th Amendment citizens. And then say to the states, well, you have to address what we've created, rather than allowing the states to address their own issues, which is by far more vital to the survival of the United States and to each state. Romney is absolutely right. It is the right of the people of the state of Massachusetts. They can bind themselves to whatever they believe and however they want to resolve their health care for their state. If that's what they want, let them have it. I don't want it. I don't want to be a part of it. But he's right. That's Massachusetts' decision. That's a states' right decision. And if you don't want to live in Massachusetts, live somewhere else that don't have this kind of a healthcare system there. But do not get the federal government involved in healthcare and begin to mandate laws that have no funding and then force the states to deal with crises that they have created. Romney does seem to get this principle constitutionally, because he asserts the federal government is simply encroaching upon the rights of the states with the idea that a single solution fits every state. And that is simply just wrong. Here we have the old proverbial tail wagging the dog. That's the problem with health care. But the right issue is let the states decide what to do. Let them deal with their health care. Their citizens are more closely related, and their representatives and senators, to the issue. Let them, their health care providers, and their citizens work it out and decide. And the rest who don't like it, if they go in a way that they don't think is proper, vote with your feet. Vote with your feet. Who knows? If you do it and do it right, we might get to resettle Massachusetts again one day, because nobody will live there under the current conditions. But it's a states' right issue, and the federal government has encroached upon it. Romney was right.